Good afternoon, and welcome back to the Principles of Seven and Hastings Community Voice. This is Dave Sharp, and today's message is for patients and families. I've had a lot of you reach out to me, and I know a lot of you are reaching out to Dr. Copur as well. And you're trying to figure out what to do about your cancer care right now. And I know many people are voicing being scared. And I know some patients had a direct relationship with Dr. Copur, where he would answer his phone day or night and help guide them through your frightening moments. And when that kind of access suddenly changes, patients can feel abandoned and confused and unsure who is responsible for their care. I want to be very clear at the beginning. I'm not a doctor. I cannot give you medical advice. I cannot tell anyone to stop treatments, delay treatments, change medications, change doctors, or choose one treatment plan over another. But I can help patients and families understand what questions to ask, who to call, and how to document your concerns. How to get to those people whose job it is to respond. This update is not about panic. It's about patient safety. It's about continuity of care and making sure no one falls through the cracks during this transition. The first rule, if it is urgent, don't wait. And this may seem self-explanatory, but for these type of videos, it's important that we cover this before we get into the nuts and bolts. If you're having urgent symptoms, don't count on Facebook. Don't wait for me or anybody else. Community group is not going to be able to help you. If you have fever during chemo or severe pain, trouble breathing, chest pain, confusion, vomiting, heavy bleeding, signs of infection, or symptoms that are rapidly getting worse, call 911, go to the emergency room, or contact your on-call medical provider immediately. Community advocacy matters, but patient safety comes first. What patients can ask for today, if you are currently in treatment, waiting on test results, or worried that your care has been delayed, here are the questions I would ask in writing or over the phone. Trace, can you pull up the document that we prepared? Awesome. Thank you. So as I go through this, I want us to, well, let's get this out of the way first. So on the screen right now, I have a document that I prepared that's going to kind of walk you through this. Let's go to this emergency rule. Urgent symptoms, fever during your chemo, severe pain, all of those things that I mentioned, call 911. Let's do that first. And then ask your provider for a care plan. If you're currently in treatment, waiting on treatment or waiting on those test results, or worried your care has been delayed, here are the questions I would ask. 1, who is the licensed oncology provider currently responsible for my care? 2, who is reviewing my labs, scans, pathology, symptoms, and treatment plan? 3, is my treatment, infusions, scans, labs, follow-up, or referral still on schedule? 4, has anything been delayed, changed, or canceled, or transferred? If so, why? And 5, who do I call after hours if my symptoms change? And don't forget, there's always the typical emergency responses, and you can call the number that you've been given for after hours care from your provider. I know it's not the same as how Dr. Copur did it, but your number one responsibility is to ensure that you are safe and taking care of yourself. 6, can I review my current plan in writing? And then if I want a second opinion or transfer of care, how do I obtain my records and how quickly can they be sent? Those are reasonable questions. Those are not political questions. Those are patient safety questions. So when you are looking at who to get a hold of, on the screen right now, and I'm also going to attach a printable document that has these numbers on it so that you can have those with you. Take a screenshot of them, pause the video, screenshot it with your phone. So right now what you're seeing is the numbers for Morrison Cancer Center in Grand Island and Hastings and Mary Landing's patient advocate line. Those are all your local contacts. If that's not getting you anywhere and you don't feel comfortable with that, on the screen right now is the escalation numbers. These are the numbers to Department of Health and Human Services, who handle health facilities and guidance regulation. We have the Joint Commission, the Medicare Commence Health Hotline, and the Nebraska Department of Insurance. When you call, don't just ask generally what is going on. Ask specifically, who is my current oncology provider? Can I have my care plan in writing? If you cannot get a clear answer, ask to speak with the Mary Landing patient advocate. The patient advocate phone number listed by Mary Landing is 402-461-5319. Mary Landing also lists a service, patient safety and quality of care concern line, and that number is 402-461-5213. If you need your records, your medical records, that department is Mary Landing Health Information Medical Records, and that number is listed as 402-461-5174. What I have on the screen now is a patient call script if you don't know what to ask. So I put this together so that you can screen record it and just pop your name in where the blank is. Hopefully that's helpful. On the screen now is the sources for contact information. This is a way for you to contact these facilities and escalation. Trace, can you take us back to full camera screen? Thanks, Trace. When you call, this is how you document it. Write down the date, the time, the number you called, and ask for the name of the person that you're speaking with. Document that. Document exactly what they told you. If treatment is delayed, changed, canceled, transferred, ask for that explanation in writing if you're concerned. Another thing that's important that we need to cover here is do not post your private diagnosis, medications, scan results, lab results publicly in Facebook comments. Protect your privacy. If you want help organizing your questions, you can say that privately, but medical decisions need to be made with licensed medical professionals. If you still cannot get help, if a patient believes they cannot get a safe answer about care, treatment, timing, provider coverage, or a serious safety concern, there are escalation options. The Nebraska Department of Health and Human Services has a health facility complaint process. Their complaint intake line is 402-461-0316. Their health facility investigations email is dhhs.healthfacilityinvestigations@nebraska.gov. They also have an online complaint form. Mary Landing is accredited by the Joint Commission. The Joint Commission takes patient safety concerns, and their public phone number for reporting patient safety concerns is 1-800-994-6610. For Medicare patients, quality of care concerns can also be directed to the Beneficiary of Family-Centered Care Quality Improvement Organization. For Nebraska Commence Health Region 7, which includes Nebraska, that number is 1-888-755-5580. And Medicare patients can call 1-800-MEDICARE. And again, I will have a link in the description of this video with a page that you can download. You can keep that with you. For insurance delays, denials, network problems, or coverage issues, patients may also contact the Nebraska Department of Insurance. Their main number is 402-471-2201, and the in-state insurance complaint hotline is 877-564-7323. I know Dr. Copur was really good about helping with insurance companies, and that's tough to replace when you've got a doctor willing to do those things. There are things that Hastings Community Voice can and cannot do. Hastings Community Voice can help organize questions for its community. We can protect your privacy. We can document patterns and advocate for transparency. We cannot give medical advice. We cannot replace an oncologist. We cannot tell people to stop treatment. We cannot tell people to wait. We cannot make medical decisions for anyone. What we can say is this: every cancer patient deserves to know who is responsible for their care today. Every patient deserves to know whether treatment is on schedule. Every patient deserves a clear phone number and an after-hours plan and a written care plan when things change. Why this matters? This issue is not whether people liked Dr. Copur. Numerous and many did. The issue is what happens to patients when a trusted oncologist's relationship changes suddenly and the community is left with unanswered questions. Cancer patients are not customers first, they're patients. They're people fighting for their lives. When cancer care changes, communication must be directed, clear, compassionate, and immediate. If you are a patient or a family member, please don't panic, do not fear, and please do not delay your care. Use this contact guide we're providing with this video. Call Morrison. Ask your current oncology provider. Ask for your care plan in writing. Contact the patient advocate if you cannot get answers. Use the state and accreditation contacts if patient safety concerns are not resolved. And please keep the public conversation respectful. The goal is not harassment. The goal is continuity, accountability, and patient safety. This is the Hastings Community Voice. Patients deserve answers. Families deserve clarity. And no one fighting cancer should be left wondering who is responsible for that care. And unfortunately, that is exactly the position that some of you are in right now. This has been Principles of 7 for the Hastings Community Voice. God bless you. Be good to one another, and have a great rest of your day.